Hi everyone, let's celebrate the mouse for all its hard work it's done in heart transplant studies. When doing a heart transplant on a mouse, what are they looking for? What are they testing? Mice have helped with the testing of immunology of heart transplants for humans. More specifically, they're used to test the acceptance or rejection of an organ. If the body rejects an organ, your immune system will begin attacking it, which could lead to organ failure. Mice have also been used to test out different techniques, so when doing a transplant on an individual, they can get desirable outcomes with limited complications. Why are mice used to practice heart transplants? Due to a mouse's small size, they are used to perform a microsurgery version of a heart transplant. Mice are used to replicate this surgery due to their resemblance to the genetic and anatomical makeup of humans. They typically use mice when doing experiments due to their easy maintenance, short life cycle, and quick reproductive cycle, along with their affordability. Who came up with the idea of testing heart transplants on mice, and what techniques are used for performing heart transplants on mice? The idea of practicing heart transplants on mice was brought about by Dr. Corey and Dr. Russell. A technique commonly used for a heterotopic transplant was developed by Corey et al. The surgery involves a complete procedure from anastomosis of the heart graft aorta all the way to the recipient's abdominal aorta and the gapped pulmonary artery to the recipient's inferior vena cava. The inferior vena cava is the large blood vessel that transports deoxygenated blood from the lower extremities and abdomen and brings it up to the right atrium of the heart. After anastomosis is completed, the heart graft will begin contracting immediately. Did you know 70.9% of patients receive a heart transplant in a year, but 17 people die each day waiting for a transplant, and 103,237 individuals are on the national transplant waiting list. Luckily, my godmother, after years of heart surgery, received a heart transplant in almost 3 months, and thanks to the research done by mice, she received her transplant without complications. Thank you for watching. I hope you have learned something new.